Hi, my name is Erik and I'm a board-certified family medicine and integrative medicine doctor here in Temecula, California. I'm the founder and medical director of the Temecula Center for Integrative Medicine. A few years ago, I was asked to sit on a panel in front of a bunch of CEOs from Nutritional Supplements Conference, and they asked me, if you had the chance to make one supplement or have a medication that you feel would be broad spectrum and change your practice, and what would it be? What would you want to treat? I didn't have to think about it very long. Immediately, pain came to mind. I mean, it affects everybody. It affects my friends, my families, it affects me at times. It's something that's ubiquitous to all of us. And it's something that we struggle with in treating because there aren't any great treatments for pain. We can mask it, but resolving pain, only the body can really do that. And so I've struggled for years to come up with ways to treat pain in a manner that will support the body and allow it to heal itself. Until now, my only options really have been an anti-inflammatory medicine or a steroid, or even worse, the narcotics, which lead to potentials for habit forming and addictions. And that leads to a whole host of other problems, as it disrupts the metabolism and lowers testosterone and can lead to changes in behavior and mental function. So what do we do, right? What do we do now in conventional medicine for treatment of pain? Besides the pain medicines, which kind of mask it, well, I can send patients to physical therapy, or I can send them to a referral for orthopedics to do a surgery to cut something out and try and reduce the pain. I mean, we can even do nerve ablations, just knock out the signal. But that doesn't actually repair any of the damage that's done, and over time that usually leads to further problems. It's like if you have a car, right, and you're driving the car, and all of a sudden the engine starts to go weird. You know, you hear that sound going over and over again. You know what I'm talking about. And so you look, and all of a sudden the check engine light comes on. You're like, oh, how do I make that go away? Oh, I know. I'll get some tape and I'll cover that up. Well, now it doesn't bother me anymore because I can't see the check engine light. Oh, but the engine's still going clunk, clunk, clunk. But I feel better because I've covered up the check engine light. In other words, the pain associated with that has now been taken care of. Does that make sense to you? It certainly doesn't make sense to me, but yet that's what we've been stuck with for a long time. We're now stepping into a time where in orthopedics and in musculoskeletal stuff, we're actually able to start doing more and more regenerative therapies. Well, this got me excited. And I actually recently, about a year ago, went to a conference to learn more about some of these regenerative therapies. One of which seemed a little strange to me at first, and that was the use of ozone. I'd never heard of ozone in medical treatment, but the more I looked into it, the more I realized that there's a lot of medical research that supports ozone for the use of regeneration and healing in the body. Well, this fascinated me, and when we combined it with using a form of PRP, which has multiple growth factors and stem cells, the sky was the limit on what we could do to help to repair the joints and the muscles and the tendons, and more importantly, to reduce pain. Since we started doing this a little over a year ago in our practice, we have seen a lot of patients significantly improve, not just in their overall pain, but in their function. I would love to tell you more about this personally in our office, and love for you to click on the link so that you can learn more about what we're doing in Temecula to help reduce pain overall and help you get back to functioning the way you want to function.